What's Zebra Technologies? Some questions are difficult to answer when you're an outstanding outstander like me. Good afternoon, Nart. Please introduce yourself and tell me what's Zebra.
Well, good afternoon. My name is Nart van Heijden, and within Zebra Technologies, I'm responsible for the healthcare market with an end-user focus. So my daily time spendings are visiting hospitals, care agencies, and analyze their challenges and have a look on what way our products and solutions can have a fit to solve those challenges.
So I'm this outstander. I come from Mars.
Yeah.
I haven't seen the planet whatsoever. Also not Zebra, of course. And how would you sort of make me warm for Zebra?
Well, Zebra Technologies is specialized in optimizing workflows. And we do that in several industries. So for example, retail, transport and logistics, warehousing.
Could it also be journalism?
Well, maybe. It depends on the application you want to implement. But we also do that in healthcare. And Zebra is specialized in developing purpose-built solutions. So what we do, in fact, is develop solutions for specific industries. So for example, we have a specific line of products for the healthcare industry, which represents special features which are relevant within this industry. So here on this table we have one of our newest products, and this is like the first healthcare enterprise tablet.
Can you show it to me and to the
course.
people who watch this?
So
looks like an iPad.
Yeah, it looks like an iPad, but I don't want to name it like an iPad because, if you have a look on the detailed features, it's totally different than an iPad. To give you an example, this is a robust tablet, so if you drop it, no big problem.
Comes back to you, boy.
Yeah, maybe depending on how hard you drop it on the floor. But it also has an enterprise life cycle. So this year, this product is being sold with an 8 years life cycle. So 4 years sale, 4 years support. So within that period, we give our end users the possibility to use this product.
Okay.
And it's made of medical grade plastics, the battery is removable, so all kind of features which are...
And what's it for?
You can use it for different applications. To give you just an example, telehealth. You see telehealth is becoming more a standard, so you don't always have to visit the hospital for the appointments you have. So in fact, the patient and the doctor could have a conversation on this tablet, and you don't have to go for every small appointment to the hospital.
Why use this machine, so to speak, for it? I could also use a Teams link.
Yes, you can also use a Team link, but to give you a better understanding of our portfolio, we sell hardware and we sell software. So my colleague Wayne will shortly...
Wayne Miller.
So the key difference here is when you're putting a device into somebody's hands, especially in a medical environment, you want that antimicrobial, you want to be able to wipe it down, so that's one of the features. This is also what we call enterprise grade, so that's a security aspect. Nord talked about its ruggedness, but we also have that ruggedness approach to the software as well. So we're guarding people's data. You asked the question about what does this device do? It brings life to those solutions, those workflow solutions. They're data dependent, so we've got to collect data and share data to drive those solutions, and that's what our various devices do, and that's two-way. It's collecting, sharing and analyzing data, and I think that's a very good example of what this device does.
Yeah. What else should I know about Zebra before I go back to Mars?
Well, there's many to tell about Zebra, but as I told you, we develop purpose-built solutions. So, 50 years ago, we started with label printers, but nowadays we do much more than label printers. So, tablets, mobile computers, but even robots are part of our product portfolio. So, robots is a very hot topic in the market, not only in healthcare, but also in other verticals, for example, warehousing. And we see many trends and developments on these topics, especially as there are major labor challenges, not only in healthcare, but also in other industries. So we see that hospitals and care agencies are looking for solutions to solve those problems.
What is a question that even Zebra can't answer yet?
Ooh, maybe I can't answer this question.
Wayne?
Well, Zebra can't answer that question.
Yeah.
You just said. You just said
Yeah.
it. To give a suggestion, we've been talking today about track and trace, which is one of the Zebra offerings. It
Like
moves
what
into
happens
that.
with our parcels
Yeah,
come to us.
and I suppose Zebra's trying to answer or trying to get rid of the question, what can't we answer? Because if you can tag it, you can trace it, you can produce data, you can give that intelligence. So we're trying to make sure that that question does not exist. So it's a difficult marketplace. Nard's talked about staff shortages, and that's where Zebra keeps not investing in staff shortages, but Zebra's investing in technology that solve the current problems, and one of those is we're not going to have enough people to do those mundane tasks.
No.
So robotics, machine vision, AI is where Zebra is investing its dollars.
So it's Zebra, not Zebra, Frenk. One of the people who showed up at this table today said to me, one thing that can't be solved so far by any company is that machines don't have moral values. And lots of decisions are being taken on ground of moral values, not only if it's efficient, if it works, if it pays off in financial terms. Lots of things have moral values in them. How are you going to solve that when you make those machines?
I think we come back to the human element. There's always going to have to be a human element. I always draw a distinction between delivery of an Amazon package or buying a tin of beans. There's not a lot of morality in that, but when treating patients and the patient outcomes and how that patient's treated, it does come back to humans ultimately, and that's what healthcare does.
But how do you solve that? That the machine cannot only do efficient things, but should also weigh those moral aspects.
I don't think we can at this moment in time.
No.
I don't think that's a question that we can answer. And would we want to do that at this stage, so early in the technology
Very
curve?
good.
Probably not.
Yeah, very good.
And maybe in the long term, artificial intelligence will be a solution for that, but I don't know exactly how that's going to
develop. The thing is that even a specialist today said soon artificial intelligence will be smarter than we are. And then it's especially important that artificial intelligence wears some sort of moral value in it. Because if it doesn't, it only takes decisions that are efficient. But that's not necessarily a good decision in the ethical sense of the word.
But also artificial intelligence must feed off the right data, and that's at the heart of what Zebra does, is feeding the right data to that AI, so it comes out hopefully with the right decision.
Yeah. If I would say that you are Mr. Kuipers, who was here this morning, he runs the Department of Healthcare in Holland, what would you do in his place? What kind of dream measure would you take? What is your wish to bring to Holland if you'd be the responsible politician?
Well, as we mentioned, the challenges within the healthcare are really big, and you see that, for example, nurses are on a tremendous amount of pressure. So my first objective would be, how can we give more care with less care? So how can we win time back in order so the nurses can spend the time with the patients? So I would have a look on how can we gain more efficient and effective workflows and digitalization.
Because of human reasons.
Yeah. In the end, it's all about the patients and it's all about the employer. So we have to keep in mind that the challenges are really heavy at the moment. So how can we improve those workflows?
Would you like to add something to that, Wayne?
Yeah, I think in our own personal lives, we work on the go, right?
Yeah.
Emails in your hands, you can, on the train, waiting for an appointment. And I think that needs to be translated into the nurses inside the hospitals and healthcare. So the information's accessible to the nurse on the move, on the go. It's not returning to that fixed point, that fixed, that laptop. It's information on the go, and hence the title of the event.
Yeah, talking about return, this machine and your whole business, in fact, how would a hospital measure the return on investment?
Well, Wayne.
Yeah, sorry, that is it. It's saving nurse time, returning nurses to caring for patients.
Yeah, like
rather than
what you
looking
said
for
just,
assets.
Nard.
I mean, Nord actually suggested that before. And it's making sure that any device that they use spends more time in the hands of the nurses than being repaired, being recharged. That's the interchangeable battery pack. But it's actually returning the people to doing the work that they went to university and trained for, rather than doing those mundane tasks of finding the things they need to do those tasks.
Last question, when did you experience yourself that these developments are good? When did you notice in your own life, whether it's about your father or mother or your lover or whatever, that it's good that these things take place?
Well, luckily, I haven't been by myself that many times in the hospital, but just to give you an example, my brother was ill like a year ago, and once you see that the hospitals and the employees are using technology in a right way, and that increases like even the patient safety, so in this case my brother's, I have a really good feeling that digitalization and technology
added to his recovery?
Yeah, correct.
Yeah. And you, Wayne?
For me, it's blood transfusion. I'm a lifelong blood donor, and from day one when I started, it's been zebra labels on the blood bag with a zebra printer, and then recently it's moving into the hospital. It's a zebra scanner that's scanning the blood bag and scanning my wristband. It's close to my heart, if you excuse the pun, but that's when it really brings home exactly what zebra do.
Thank you, both of you.
Thank you.
Thank you.